Between nursing and CEO, which one is better? I want to answer this question in terms of disadvantage and advantage of CEO or being a clinical officer and being a nurse. Hello guys, welcome back to my YouTube channel. In case you're watching this video for the first time and you have not subscribed, please do so because it is very important and that is the only way you can support me. So what are these advantages and disadvantages? Answering this question in terms of disadvantages and the advantages of being a CEO and being a nurse is not enough for you to choose which career you want. What matters is the passion you have and the skill you get from that profession. So just get skills and have passion in a certain career, and then everything will be okay. It is not always that what is more marketable, sometimes it is always just a matter of skill. If you already have the skills, then you can focus and you can do other things better than anybody who just did other courses which are not more marketable and even which are not known. So it is just a matter of having skills and passion on the course you have chosen or the career you are doing, and then you can penetrate on this life. Yeah. What are these advantages and disadvantages of being a nurse? Don't worry, I'm shaking because I'm holding the phone while I'm shooting. So the first advantage, let me start with nursing, the disadvantages and advantages of nursing. So I will start with the advantages. Number one is it is known worldwide. Nursing is known worldwide, to mean you can work anywhere in this world. You can work in your country, you can work elsewhere in outside your country, or maybe abroad, anywhere in this world. The second one is nursing start from certificate. So if you did not get a chance to join or to start your career as a nurse at degree level, you can start at diploma and certificate. You can start from certificate, you upgrade to diploma, then degree, slowly by slowly. The next thing is salary is more compared to other professions, like maybe being a teacher. If you compare their salary with the nurses' salary, the salary of nurses are more. The next thing is nursing get opportunity to continue with their education. During their work or when they are still working, they can get an opportunity. Nursing, some things are always changing and they need to get updated to the changing they need to get updated to the new things. So they get opportunity to go and learn new things, and also when you are working you can still have opportunity to go and upgrade yourself or your education. Another thing, if you don't want to become a general nurse, you can specialize to the field you are interested in and you continue doing your work very well. If you want to be a theater nurse, if you want to be a pediatric nurse, where any field you are interested in, you can go and specialize there. Another thing is that the nurses usually work at different shifts. You get that a nurse can do night duties for 5 days and they get 7 days off. So if this one gives them opportunity to do other things very easily without contradicting with this profession, they can do also other things because their shift usually change. They can work night shift, they can work daytime, and also when they get their offs, it is usually long, so they can do other things also, and maybe also they can upgrade on their profession. Another thing is that nurses has an opportunity to start a nursing home, to start a clinic, to start a hospital, so that is also an advantage to them. And last one, nurses has an opportunity to achieve wellness by giving treatment, caring for the sick, and promoting health. So that is also it is also an advantage to them. Helping someone to achieve wellness or to achieve his health or her health is something that is also very important. So what are the disadvantages? Sorry, what are the disadvantages of being a nurse? Number one, long working hours. If you are a nurse and you are lazy, you can't work for long hours, then you should just quit your career. Number two, there is night shift, and night shift sometimes is always heavy. And that one will take me to number three, that there is a heavy workload in nursing. It is not just as easy as you may think. And number four, also, nurses usually they don't have time for even themselves because they work long hours, and they also have other things that they are supposed to do. So they don't have even times for themselves, for their family, for their friends, because they focus on the promoting health, curing, among others. Those are the most important things that the nurses usually focus on. So they don't have any time for themselves. The next thing, nurses sometimes can break down because of the way they see the patient suffer, the way you can think that you are helping this patient and the patient just pass. And the last disadvantage is stress and pressure that sometimes they can get from the patient and the relatives if you don't do what they expect or what they want, especially if their patient has died and they think that you did not do the right thing. They can really harass you, they can really pressure you, and sometimes it is not good, and you can go through a lot of stress, a lot of pressure, and even depression. So what are these advantages of being a CEO? The first one, salary is more, of course, compared to nurses. The second one is it has more specialists compared, or specialists. Hey, CEO has field of specialists, more field of specialists compared to nursing, and also they have an opportunity to open a clinic, and also there is less work. If you're a CEO, you just need to clerk your patient and go away. That CEO don't do a lot of work. They only clerk the patient, and most of the procedures because are done by nurses, and so less work and more salary. Yeah. So what are these disadvantages of being as what a CEO? There is no certificate. If you want to be a CEO, you have to get a good grade that you can start your career from diploma or degree. And then also CEO has less job opportunity because it is only known in Eastern Africa. So you will only work in your country and maybe within Eastern Africa. And also another thing about CEO, I think those are the only things, disadvantage and advantages of CEO. No certificate. It is only known in Eastern Africa and your country, maybe. Yeah. And those are, I think, that are things. And something about nurses. Nurses are more, they can get infection easily because they are the patient. They're the people who stayed long with the patient. So I think they are more exposed to infection and also needle prick. Bye guys, let's meet in my next video. I think this one will be more helpful for some of you. Bye.